Hello everyone. So in this video we are going to discuss about the part 2, that is the trapezius stretching. So the pain. Now what to do? So just you have to stretch your muscle and pain get relief. Let's start. The causes of the pain. So stress, the overuse of the muscle, the poor posture for the long time, and the trauma which leads to damage your muscle and it gets pain. Here the simply anatomy which we discussed in part 1, but just briefly revise. Here it is the upper part of the trapezius which do elevation of the scapula, the middle part which retract the scapula, and the lower part, that is lower fiber, which depress the scapula. What is trapezius muscle spasm? So overuse of the trapezius muscle is the most common cause of trapezius muscle spasm, as when the muscle is being overused, it causes the muscle to get fatigued and ultimately it leads to strain or rupture of the muscle, which give you excessive pain at the upper back and the neck region. The trapezius can become painful or sore for many reasons. The pain in the trapezius may also have accompanying symptoms such as muscle stiffness, the shoulder or neck pain, muscle spasm, tingling or numbness in one or both arms, and decreased range of motion due to pain in the shoulder and the neck region. Now pain. So what to do now? So just you have to stretch your muscle. So stretching can help keep the trapezius muscle from getting too tight. It may also prevent or relieve the pain. Okay, whenever you do a excessive work without stretching of your muscles, so it get tight and it gives you pain. So just simply you have to stretch your muscle in between your work. When stretching, it is important to move in and out of the stretch, gently avoiding jerky movements and bouncing. Hold the stretch for about 15 to 30 seconds. So for that, you apply some stretching techniques. Let's see. In the first figure, the patient is in the standing position and just ipsilateral sides flex the neck. Okay, so that gives a upper trapezius stretching. In second diagram, it is also in the standing with the wall support. Just retract the scapula. So this also stretch your trapezius. Other technique in the sitting position. The patient is in the sitting position. Left hand around parietal or occipital area. Tilt head or neck to the left side because you want to stretch at the right side. Then depress the right side scapula and shoulder, whatever you say, and good seated posture with the neutral spine. And then you gently do a stretching of the right side. The other same technique, that is a worker which in the diagram, okay, computer worker, so they gently stretch this trapezius muscle which gives pain relief. So this is also known as ear to shoulder stretch. Here the another technique in the sitting position. This stretch involves both the neck and the shoulder muscles. Begin by putting the right arm behind you and grab it with your left hand because you want stretching of the right side. Pull the hand gently toward your left side and tilt your left ear toward your left shoulder. So this causes a stretching of the right side. Same another technique, that is hug stretch. Here another technique, that is retraction of the scapula without wall support. In first diagram we see same technique but with the wall support. So you do any technique whatever you want. Here another technique in the supine position. So first figure, the patient is in the sitting position, then it lie down on the floor and hold the both arms behind the neck, behind the back, and then gently literally flex the neck, so which cause a stretching of the trapezius muscle. Thank you.